Okay, here's our cyberanatomy video for the lab 13, the cranial fossa. This is going to be pretty short. This is a short lab, so we should get through this pretty quickly. So we are going into the cranial vault. The skulls have already been sawed open, as you've noticed. The brains have been removed. Where we're going to be working is, in this space and identifying structures in the cranial vault. If you have your brain handy, you might be able to find the superior sagittal sinus. It's a large vein that runs right down the middle of the in between the two cerebral hemispheres. It may also be on the inside of your skull, so have a look in a couple of different places, see if you can come up with that, because the first thing we're going to do is go through these venous sinuses. They're colored blue here because they're like veins. They have deoxygenated blood, but they're not exactly veins. That will all be made clear in lecture later in the week. But there's more of them down on the cranial vault floor. And the first ones that we're going to try and find are the cavernous sinus. These are on either side of the sella turcica, right next to the trigeminal ganglia, and usually the ganglion sort of wrapped up in it. It's not going to really look anything like this because there's going to be dura mater covering up all of this surface throughout here. So on one side of the skull, you're going to peel off the dura mater to try and expose these nerves, expose the cavernous sinus. It's actually a blood-filled space within the dura mater, so it might be, in some ways, it might be easier to see on the intact side if you can see a little bit of darkness underneath the dura. But in any case, we have a cavernous sinus on both sides of the sella turcica of the skull. This drains back to a structure called the superior petrosal sinus, which runs right along the superior petrous ridge. And then that joins up with the sinus called transverse, which was running transversely across the occipital bone. And then when they come together, they form this sinus called sigmoid sinus that heads down towards the jugular foramen. So I think I'm kind of going out of order here. There we go. There's our sigmoid sinus label. And then that brings us down. It's sort of an S-shaped curve. You've seen the groove on the skull, so now you'll see the sinus that is lying in the groove. And that'll take us right down to the jugular foramen, where it'll become the internal jugular vein. So good review of some skull anatomy and doing those sinuses. It shouldn't take you too long. The dissection is basically already done. Incidentally, the only area where we need to remove dura is really the middle cranial fossa. We don't need to do posterior fossa or anterior fossa. Okay, so then the rest of your work is going to be looking at nerves and arteries. It's really not going to look much like this because you see there's nice long nerves that are, this is the whole pathway all the way to the brain. When we remove the brains, we cut the nerves off a little bit shorter so that there's more on the surface of the brain. And we'll be able to identify them easily in the skull because they're associated with the foramina. It's just much more helpful if we're identifying them on the brain to have more long nerves on the surface of the brain. So I'm afraid this picture is not particularly much like what you're going to see, but the atlas images are much, much better, and it usually looks almost exactly like it. So have a look, see the different foramina, the different cranial nerves. You should be able to identify all 12, although you won't actually see one. You'll see the olfactory bulb. One is indicated here, these little teeny tiny lines that are going through the cribriform plate. Cranial nerve 2 through the optic canal, 3, 4, and 6 through supraorbital fissure with V1. Look for the trigeminal ganglion on the side where you remove dura. You should see all 3 parts of it. And then you'll see the V3 part going through foraminal valley. If we get this cavernous sinus out of here, you'll see some more the different nerves. Here's V2 going up to the foramen rotundum. Also, I'm not sure this is particularly realistic. Usually the trigeminal ganglion is a bit bigger than this. It usually would occupy about this much space. And then the individual branches V2, V3, V2, V1 would not be quite so long. But in any case, that's sort of what you're trying to expect. The cranial nerve 6 will be kind of an oddball because it looks like it's going like here it's just running right along the bone, has quite a long path all the way up to the superior orbital fissure. In your skull, there's going to be dura that's covering this up, so it's going to look like it's going into a hole on the clivus, but in fact it's just going underneath the dura. So that's something that will be unexpected, because as you know, there's no frame in there. You'll also see cranial nerves 7 and 8 that are running through the internal acoustic meatus, 9, 10, 11 at the jugular foramen. These will all be relatively short pieces of nerve, and it will be hard to differentiate one from the other outside of anterior-posterior orientation. You'll note, if you look at this model, you'll also see there's an error. The spinal accessory nerve is coming up from below, as it should, but instead of going out through the jugular foramen, it's going through, oops, a hypoglossal canal, and hypoglossal up here going through jugular. So this is obviously an earlier version of the simulation that has a couple of little neurological mistakes in it. So yeah, have a look at. We'll do all 12 cranial nerves. You should. This is a good opportunity to review the foramina that they pass through. And then the last thing you're going to do is identify some arteries, just a handful. You should be able to see the middle meningeal artery where it comes through foramen spinosum. It might just be a cut off little stump, or you might actually have quite a lot of it running along the surface of the bone. For sure you'll see grooves in the bone surface for the artery. We'll also look for the ophthalmic artery, which goes with the optic nerve through the optic canal. So you want to look for that pairing. It's definitely not this big. That's a little bit out of proportion. The vertebral arteries, you'll see those coming up through foramen magnum. You might even see them joining. That's a possibility. And the internal carotids are these big arteries that are appearing right next to the sella turcica. If you haven't figured it out yet, the carotid canal or the carotid artery has kind of a weird path, and it's weird going through the bone, and it's weird once it gets into the skull. So you can see it here where it's emerging from the carotid canal, but then it has this weird like C-loop thing that happens alongside the sella turcica before it wraps back to where it would connect to the brain. So you'll see some of this. You probably won't see a whole lot of this because there's going to be a bunch of nerves in your way, but you'll definitely see this portion of the internal carotid. But just try to understand that weird shape of the internal carotid. It's something that eludes people early on in the course. So that's this lab in a nutshell. It's really just a big review of most things from that you've already learned about in the course. So I would consider this a great lab to review prior to lecture for Wednesday's test. So enjoy. I think it's going to be a good one.